This video will explain the physiology of the menstrual cycle. First, we'll talk about the four major hormones involved. First is FSH, or follicle stimulating hormone. Next is LH, or luteinizing hormone. And there is estrogen and progesterone. FSH comes from the pituitary and stimulates the ovary to make estrogen, as well as stimulates the follicle to mature. LH also comes from the pituitary and stimulates the corpus luteum. Estrogen and progesterone come from the ovary. Next is a graph showing the days of the cycle at the bottom. In the first few days, the FSH starts to rise in response to the lack of estrogen at the beginning of the cycle. FSH again stimulates the ovary to make estrogen, and since it stands for follicle stimulating hormone, it also stimulates the ovaries to make the follicles mature and prepare the oocytes to become ova before it pops out and becomes fertilized. The LH at this time, the first 14 days, stay relatively at low levels, and so do the progesterone levels. Just before day 14, a significant event happens. The LH levels spike, and the FSH also rises, but not quite as dramatically. The LH spike produces the ripened follicle to pop out an ovum that will travel down the fallopian tube. At this point, what was once the follicle that ejected the ovum, this becomes the corpus luteum, or yellow body. The corpus luteum is metabolically active and produces progesterone throughout its lifespan. The corpus luteum lifespan is about 14 days. The rise in progesterone levels change the lining of the uterus and makes the endometrium more receptive to the fertilized ovum. At the end of 14 days, the corpus luteum atrophies. It stops producing progesterone, and then the levels of progesterone drop with the levels of the estrogen. Then the endometrium is no longer stimulated, so it sheds to form menstrual flow. With the low levels of estrogen and progesterone, the cycle starts again by rising levels of FSH. If the ovum becomes fertilized, it implants within a few days on the receptive endometrium. It grows, and the embryo starts to produce HCG, or chorionic gonadotropin. HCG stimulates the corpus luteum to continue to make progesterone instead of atrophy. It stimulates the corpus luteum, and with the stimulation, the progesterone keeps the endometrium habitable for growing the embryo. Hence, the pregnancy is allowed to continue. In another scenario, when a woman takes birth control pills, ovulation is suppressed because the external estrogen and progesterone keeps the FSH and LH from rising. Without a rise in LH and FSH, the ovum cannot be matured and is not allowed to pop out. One form of infertility is due to a shortened lifespan of the corpus luteum, or inadequate luteal phase as it's called. In this scenario, progesterone is given, shown by the thick red line, until the embryos can produce enough HCG to stimulate the corpus luteum to continue to produce progesterone and keep the embryo viable. In the case of menopause, the ovaries become unable to produce any estrogen, and because of that, there are steep rises in the FSH and LH in attempt to make the ovaries make estrogen. And because it's unable to, the FSH and LH continue to rise. It is said that the rise in the LH is responsible for hot flashes. When a woman is given hormone replacement therapy, which includes an external estrogen and progesterone, as illustrated in the thick red and yellow lines, the FSH and LH start to decline and the hot flashes uh, decrease. So this is the video that explains the physiology of the menstrual cycle. It also shows the scenario of when the woman gets pregnant and what happens. It also shows a scenario of when what happens when birth control pills are taken, and the scenario of menopause.